Hi, Mr. Graham. Would you give a short introduction of yourself?
I'm an Australian. I live in Queensland. In January 2008, I got diagnosed with lymphoma, B-cell lymphoma. After treatment, a lot of chemotherapy in Brisbane, and reoccurrences of it. December 2010, they told me that they couldn't give me any more treatment. At that time I had a lymphoma in my chest. They'd done my neck had swollen up, and they'd done a PET scan, CAT scan, and found a lymphoma in my neck, or multiple lymphomas in my neck, and also a lymphoma, 27 or 25 millimeter lymphoma in my chest that was too close to my esophagus for radiation treatment and too far in for surgery. And they'd already tried a half dose of chemo that might have worked, but me blood went down that low that they had to stop treatment. So December, about the 23rd, they told me that they couldn't give me any more treatment options and that there was nothing else they could do for me in Australia. It was only before then, my wife's sister had married a Swiss national, and he'd had treatment at Xinshan 10 years earlier in China. And when he heard about it, he just said, go get in touch with these people and go to China. So after a few emails, I ended up in Beijing. That was in February 2011. They tried chemo in Beijing, and my body wouldn't take it, so they kept me in hospital for about 6 weeks, feeding me immunotherapy and drugs to get my blood up, and then they gave me 2 cycles of CIK therapy. And on the Sunday they gave me the last blood of the CIK got infused, and Monday they done a CT scan, and the lymphoma had gone down to 15 millimeters. They'd measured on a CT scan. They gave me, Dr. Shan recommended what he called micro chemo, and gave it to me in tablet form. I took that back to Australia, but none of the doctors in Australia wanted to know anything about it. So it's still in the fridge at home, basically. In July, I had a PET scan, CAT scan, and the lymphoma in my chest had gone down to 14 millimeters by the same machine that had measured 27 millimeters in December. And the ones on my neck you couldn't feel anymore. So I thought I was pretty right. Then October 18th, I had another PET scan, CAT scan, and they found the lymphoma in my chest was just a small calcified lump with no take up in the dye showing there was any cancer or any activity or anything like that. It was basically gone. But they found multiple little red lumps of lymphoma, we think, in me vertical colon and down lower. So after talking to the urologist and another doctor, it was virtually agreed that I could, the only option they could give me in Australia was more chemotherapy. So I just said thanks but no thanks, and got on a plane and came back here again. So this is where I'm up to now. Dr. Shan has got me through 1.5 lots of what he calls micro chemo, and I'm halfway through, my blood is away right now getting cultured for the second lot of CIK therapy. That is it in short. I had a lymphoma here, I had to cut down the side of my face. The surgeon took that out, and that's about my history so far, from January '08 to virtually early December 2011. I would have had about 10 lots of chemo, been in hospital numerous times, and that's where I'm up to now.
Okay. So did you consult your doctor before coming to China for the treatment?
The oncologist or hematologist in Brisbane was very sympathetic towards me, but basically they say, when they say that we cannot op you here, you know, he said, I've discussed this with you before, surgery's out, radiation therapy's out, we've tried chemo and your body won't take it, therefore we cannot offer you any more treatment options. Do you understand what I mean, what I'm telling you? That's pretty well it for it. I just thanked him for everything they've done for me, and I said I'm thinking seriously about going to China. With that, he acted very concerned, but he didn't voice an opinion, of course. Other doctors I spoke to virtually just laughed at me. I might as well said I was heading to the moon or going to South Africa for treatment or something like that. It was just a bit of a joke amongst some of the doctors.
So what was your opinion before making your decision to China for treatment? Did you have any worries before?
I had lots of worries. I'd never ever, up until about 2 weeks or 3 weeks before I left, I'd never even thought about going to China. I'd never considered China. But when you haven't got any options left, it's a fairly easy decision to make. You just say, well, I haven't got much to lose. Harry, the person that told me about coming here, he's in his 11th year now. He was treated 11 years ago, and I'm still emailing him and talking to him. Okay, so he's still walking around, still living. He's 77 now, and he's still living a good life. So he hasn't had any reoccurrences or anything like that. So he just said, just get on a plane and go to China.
How well did our doctor communicating with you?
Small problems with doctors, with Dr. Shan and Dr. Howe, but had a good translator. She is almost a doctor, and I couldn't have got any better treatment anywhere. I'm very, very happy with the nurses and the doctors. This hospital, when I was talking to them the second time, they said we send patients to a different hospital now, and I said I'd much prefer 304 because I know the area and there's food everywhere around this hospital. You can go for a walk, there's people everywhere, everything is here, and I was very, very happy with Dr. Shan. He seems to know me, well, he knows me body now, and I could, I didn't really want to go to any other doctor, so I'm perfectly happy. I was perfectly happy then, and I'm perfectly happy with what he's done to me right now.
Are you well informed with your status, treatment procedures, or recovering period expecting?
I'm very happy. Dr. Howe is in charge of all the patients. She drops in virtually every day and asks me, do I have any discomfort or have I got any problems, which I haven't. And I get along with everybody very well. Dr. Shan is very hard to talk to, or not hard. He's hard to get he's very busy to get a conversation with, but he's a hard-working doctor, the same as all the other doctors and nurses here. But definitely no problems, and he talks to you in a civil manner and up front, and that's it. This is all you can ask from a doctor.
So how's the customer service?
Customer service, there's sometimes a language barrier, but I don't speak very good Chinese. That's probably the only problem is me. But I'm happy with the service. I'm happy with the food. I'm happy with my room. I'd be back here. If there's any more problems, I'll be back here as fast as I can.
So are you satisfied with the treatment?
I'm very satisfied with the treatment. I don't think you'd get better treatment anywhere. You push the button and you want a nurse, there's one here straight away. If you've got a problem, you just go and mention it to somebody and they can't help you enough. There is a language barrier between some of the nurses, but they nearly always find a nurse that can talk English, or you can tell them your problem and you get it enough, you get it through well enough anyway.
So how did you feel after the initial treatment?
I felt really well. I thought I was getting really better every day, and I was getting fitter and fitter, and I thought I'd really beaten this disease, because the lymphomas on my neck, you couldn't feel them, and I just assumed that if the other lymphoma was following this one, it was under control. It's only that I went and got another PET scan after 3 months. I got another PET scan, CAT scan, that we found the problem in me colon. But even my own doctor admitted that, he said, you're better off going back to China and getting another 2 CIK treatments. So I think he is a converted doctor now. The doctors in Australia are very, very or ill-informed, or just don't want to know about these treatments in China.
Would you recommend other patients to seek treatment at Cancer Therapy China, and why?
I'd recommend anybody to come here, because compared to the chemo that I got in Australia and compared to the micro chemo that they gave me here, it's like a walk in the park. The CIK therapy, there's just no pain whatsoever. It's just, they take 100 mils of blood, take it away for 12 days, and then it starts coming back 1 day at a time. They infuse it, and you might get a temperature, and that'd be it. Like, there's no problems at all. It's a very, very easy treatment to get, and it seems to fix all your problems in one hit.
Do you have any info or tips you think would be useful to share with other patients?
No useful tips to share with other patients. Bring a DVD player and plenty of movies, and a good iPod. That'd be all I could say. The TV, I don't understand Chinese. I get about 40 TV stations and only one government English speaking station. That's all I could recommend. The rest is just come here, relax, take it easy, and trust them.
So do you have any more suggestions for us?
No, just advertise in Australia, advertise everywhere. Wouldn't be 1% of the population in Australia that would think about going to China for any cancer treatments. That's all I could say, is just give everybody the news that there are alternatives to the Australian treatments. That's all I could say.